Hello, my name is Samantha Banks and I will be performing a physical exam for NR509 Advanced Physical Assessment.
Hello, my name is Imani Wise and I give permission for this examination to be recorded and submitted to Chamberlain College of Nursing for grading purposes.
Now I will do an environmental scan, 360-degree scan of the room. I also will note that gloves are worn in the video per patient and provider preference. I'll begin with introducing myself. Hi, Imani, I'm Samantha. I will be doing your physical exam today.
Hello.
Hi. All right, we're going to begin with inspecting the skin on your face, and I note that I don't see any redness or lesions. Also, your head is midline and symmetrical. All right, I'm going to begin my exam by palpating your lymph nodes, beginning with the preauricular lymph nodes in front of the ears and the postauricular lymph nodes behind the ears. Going back to behind the head to palpate the occipital lymph nodes. I'm going to move my hands forward to palpate the tonsillar lymph nodes. Coming under the chin, I'll palpate the submandibular lymph nodes, and finally the submental under the chin. Next, we have the anterior cervical lymph nodes, the posterior cervical lymph nodes, and the supraclavicular right above the clavicles. And I do not feel any enlargements, and they are equal bilaterally. Now I will test cranial nerve 5, which is the trigeminal nerve. It has two components. To test the motor component, I'm going to palpate over the masseter muscle and ask you to clench your jaw. I do not feel any distortions, and you have great strength there. Now we'll test the sensory portion of the trigeminal nerve, and I'll ask you to close your eyes. Let me know where you feel my touch.
Forehead, left cheek, right cheek, nose, chin.
Okay, perfect. Cranial nerve 5 is intact. Next, I will test cranial nerve 7, which is the facial nerve. And I'm going to ask you to make a series of facial expressions for me, starting with a smile. Perfect, it's nice and symmetrical. All right, now frown for me. That looks good. All right, raise your eyebrows. Good, nice and symmetry there. Puff out your cheeks. All right, and then pucker your lips for me. Perfect. Everything is normal and intact. Okay, we're gonna start with assessing your ears. Now, first, note that they are symmetrical and midline. I do not see any nodules or lesions. Now I'm going to inspect the inside of your ears with my otoscope. All right, and I'm going to start on this side and looking at the external auditory canal. I see that it is clear. There is no redness or drainage or swelling or cerumen. The tympanic membrane is pearly gray, and there is no effusion in the middle ear. I'm pulling the pinna up and back as I do that. All right, on this side, pulling the pinna of the ear up and back. I'm going to take my otoscope and inspect the external auditory canal. I see that there is no swelling or drainage or redness or cerumen. The tympanic membrane is pearly gray, and there's no effusion in the middle ear. Very good. Now I will palpate your ears. And I'm checking for any nodules or tenderness on the pinna. Any tenderness there?
No.
Okay. Any tenderness on the tragus?
No.
In front of the ears?
No.
Awesome. Okay, next I will test cranial nerve 8, which is the acoustic nerve that tests your hearing, okay? So I'm going to ask you to cover one of your ears, and I'm going to come behind you. You can stay like that. And I'm going to cover my mouth and whisper 3 words and let me know what you hear.
1, 2, 3.
Okay, and we're going to do the same on the other side.
4, 5, 6.
Okay. Acoustic nerve is intact. Now I will inspect your eyes, starting with the conjunctiva. I'm going to pull this down here. I see that there's no redness. It is pink and moist. No drainage in there, no lesions. The sclera is white and clear. I will test cranial nerve 2, which is the optic nerve, which covers central vision. And I'm going to use my Snellen eye pocket chart and stand 6 feet away from you. So if you will cover one eye and read the lowest possible line.
LTFPH.
All right, and the other eye?
LTFPH.
And now with both eyes.
LTFPH.
Perfect. And your central vision is normal, 20/20 in the right eye, left eye, and in both eyes. Now we will test the optic nerve, cranial nerve 2, again for peripheral vision this time. I'm going to ask you to stand up so that we are at eye level. And I'm going to do a field vision test. And I'm going to start down. Do you see my hands now?
No.
Let me know when you do.
I see them.
Okay. I'm going to come up above. Do you see my hands?
No.
Let me know when you do.
I see them.
Okay. And then out to the side. Do you see them?
No.
Let me know when you do.
I see them now.
Perfect. All right. And peripheral vision is intact. All right. We're going to test optic nerve, which is the cranial nerve 2, which is the optic nerve again for pupillary response to light. I'm going to do that using my ophthalmoscope this time. Okay. I'm going to ask that you stare at my nose, and I'm going to bring this from the side and check your pupil response. And I see that it constricts, okay? And on this side, perfect. And your pupils are 2 to 3 millimeters in size, and they both respond to light equally. Now I will test cranial nerve 3, the oculomotor nerve, cranial nerve 4, the trochlear nerve, and cranial nerve 6, which is the abducens nerve. And what we're checking for is are the extraocular muscles of the eye. And so I'm going to ask you to follow my finger using your eyes only. Don't move your head. And I'm going to use the H pattern to test those muscles. Okay. And all EOMs are intact equally. Now I'm going to inspect your nose. I note that it is symmetrical. I don't see any obvious fractures or deformities, and it is midline. Now I will inspect the inside of your nose using the speculum of my otoscope. Okay. I'm going to tip your nose back and use my light source to inspect the left turbinates, and I do see moist and pink turbinates. I see that the midline is septum. The septum is midline, and there's no deviation. I'm now looking on the other side. Pink and moist turbinate. There's no drainage or obstruction. The septum is midline without deviation. Now I will palpate your sinuses, starting with the frontal sinus. Let me know if you feel any tenderness. Any tenderness there?
No.
Okay. And now the maxillary sinuses. Do you feel any tenderness?
No.
Perfect. Okay. Now I will inspect the mouth. Starting with your lips, I see that the lips are nice and pink and moist. Now I will use my light source to inspect your mouth. All right, so I'm going to ask you to open your mouth. Starting with your teeth, I see that they are straight and there are no cracks or obvious signs of decay. Open your mouth for me. That looks great. Your gums are healthy pink. There is no drainage or polyps or lesions. Also, the buccal mucosa on both sides is pink and moist. Inspecting the upper hard and soft palates, they are intact. There's no redness or drainage. And now open your mouth. I'm going to view the posterior pharynx. It is pink and intact. There is no postnasal drainage. And if you would lift up your tongue for me. And looking at the floor of the mouth, there are no lesions or redness or drainage, and that is a healthy pink and moist as well. All right. Next, I will test cranial nerves 9 and 10. Cranial nerve 9 is the glossopharyngeal nerve, which is the gag reflex, and we will not be testing for that. Cranial nerve 10 is the vagus nerve, and I'll test that by asking you to say ah. Open your mouth and say ah. All right, and I see that the uvula is midline, and it does rise symmetrically with phonation. And also I'll grade your tonsils at 2+, which is normal. Now I will test cranial nerve 12, which is the hypoglossal nerve. And I'll do that by asking you to stick out your tongue and move it side to side for me. Excellent. Now I'm going to palpate the temporomandibular joint, or the TMJ, and I'm palpating for any crepitus or clicks or abnormalities. If you will open and close your mouth for me. Perfect. And I do not hear any clicks or feel any crepitus there, any subluxations. So that is intact. Now I will inspect your neck, and I see that it is midline and symmetrical. Now I will palpate the trachea, and I note that it is midline as well. I'm going to palpate the thyroid, and I'll do that by locating the cricoid process with one hand and the suprasternal notch with the other hand. And I'm going to place my hands on either side of those two landmarks, and I'm going to retract on one side and ask you to swallow for me so that I may palpate the thyroid. Perfect. And I feel the thyroid rise. I'm checking it for size and any nodules, which I don't feel any. And I'll do the same thing on the other side. Retract slightly, ask you to swallow for me. Perfect. And I feel the thyroid rise. There's no nodules or abnormalities. Now I will palpate the carotid arteries on both sides of the trachea. And I note that they are normal and bounding. Now I will auscultate the carotid arteries, and I'm listening for any bruits. And I'll ask you to take a deep breath in and hold it so that breath sounds do not distort my auscultation of the carotid arteries. So go ahead and take a deep breath in and hold it. And you can breathe. Perfect. All right, and on the other side, deep breath in and hold it. Perfect. Breathe. And I did not hear any bruits. Now I will test range of motion of the neck, and I'll do that by asking you to bring your chin down to your chest. That's flexion. All right, and look straight ahead. Now look up toward the ceiling. That's extension. All right, and now if you'll look over your right shoulder, rotation, and your left shoulder, rotation. Perfect. All right, and now we're going to do lateral flexion by bringing your ear to your shoulder, lateral flexion, and the other side, lateral flexion. And there's good range of motion in the neck. Now I will auscultate your heart sounds with the diaphragm and bell of my stethoscope in all 5 areas. And I'm going to start with the aortic valve, which is at the second intercostal space, right of the sternal border, to the right sternal border. All right, and then the pulmonic valve, second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Then the tricuspid valve, fourth intercostal space, left sternal border. And ending with the mitral valve, midclavicular line at the fifth intercostal space. I'll do the same with the bell of my stethoscope. Aortic valve, second intercostal space, right sternal border. Pulmonic valve, second intercostal space, left sternal border, Erb's point, third intercostal space, left sternal border, tricuspid valve, fourth intercostal space, left sternal border, and finally the mitral area, fifth intercostal space, the mid-clavicular line. Excellent, and heart sounds are normal. Now I will auscultate your lung fields of the anterior chest in all 6 areas. And I'll just start, you're gonna take a deep breath in and out through the mouth in all 6 areas, starting with the intercostal spaces. Good. Perfect. Lung sounds are clear bilaterally. Now I'll ask you to stand and face that way. I'm going to listen to the posterior chest, posterior lung fields. Deep breath in and out through the mouth. I'll make sure to get the lateral right middle lobe. Thank you. You can have a seat. Lung sounds are clear. Now I will test cranial nerve 11, which is the spinal accessory nerve. And I'll do that by placing my hands on your shoulders. I ask you to shrug your shoulders for me. Okay, perfect. And that was cranial nerve 11. Now I will assess range of motion of the upper extremities, starting with the hands, and I'll assess the joints of your hands. I notice that I don't see any redness or swelling of the joints. I'm going to now test for capillary refill on one finger on both hands. I'm going to squeeze until the nail turns white, and then I'll release. And I see that it turns a healthy pink in less than 3 seconds, which is a normal capillary refill. I'll do the same on the other side. Press down and release. And nice brisk capillary refill on that side as well. Now I will palpate the radial pulses. I ask you to hold your hands like that. I'm going to assess bilaterally. And they are 2+ and bounding. Perfect. And I'll test hand strength. I'm going to ask you to squeeze both of my hands as tight as you can. Perfect. And the hand strength is 5 out of 5 bilaterally. Now I will test cerebellar coordination using rapid alternating movements. And I'll ask you to take your thumb and touch your index finger and then your middle finger, 4th finger, 5th finger, and do that over and over. Okay, you do that very well and nicely coordinated. Now I will test rapid movements of the palms on your thighs. I'm going to flip them over and do that back and forth, increasing the speed. Perfect. Nicely coordinated. Very well. All right. Now I am going to assess passive range of motion of the upper extremities. And typically the range of motion would be done bilaterally, but for this exam, we're just doing it unilaterally on one side. All right. And so we're going to test passive range of motion first of the elbow with flexion and extension. Perfect. And now we will test passive range of motion of the shoulder. And we'll start with flexion, extension, internal rotation, external rotation, abduction, and adduction across the midline. Perfect. That's a great range of motion of the shoulder. Now I will test the strength of the biceps and triceps. And so I'm gonna ask you to flex your elbows here, and I'm gonna put resistance and pull it toward yourself. Okay, perfect. And now push against, do like this. You want to push against my hands. Perfect. All right, and the biceps and triceps are strong on both bilaterally. Now I will test the deep tendon reflexes. Starting with the biceps tendon, I'm going to be placing your arm on mine to rest it, and putting my thumb on the medial aspect of the antecubital fossa. I'm going to strike my thumbnail with the sharp end of the hammer. All right, and you flexed your biceps tendon well on that, so that is intact. Next, I will be checking your patellar reflex with the flat end of my hammer. Okay, and the patellar tendon is intact. And now, lastly, we'll be checking the Achilles tendon. And I'm going to ask you to relax your foot. I'm going to dorsiflex your foot slightly and hit the Achilles tendon with the flat end of my hammer. And you did have a little bit of pronation there. Perfect. All right. Next, I'm going to ask you to lie down for the abdominal examination. Okay. Perfect. And I will expose your abdomen here. And first, I'll be inspecting the abdomen for any contours, or I don't see any obvious masses or any deformities. I'm going to auscultate the abdomen in all 4 quadrants. Okay. And bowel sounds are present and normal active in all 4 quadrants. Now I'm going to assess or auscultate for bruits using the bell of my stethoscope, starting with the aortic area, which is midline just below the xiphoid process. Then the right renal, which is lateral to the right and above the umbilicus. Then the left renal, which is lateral and above the umbilicus on the left side. Then the left iliac, which is lateral and below the umbilicus. And the right iliac, which is lateral to the right and below the umbilicus. And I do not hear any bruits. Now I will percuss the abdomen in all 4 areas. I'm percussing for any tympany or dullness, flatness, and that is normal. Now I will palpate the abdomen in all 4 areas for any tenderness or masses. Okay. Next, I'm going to palpate the liver and spleen. To palpate the liver, I'm going to, on the right side here, be putting my right hand underneath your side. And I'm going to take my left hand and ask you to take a deep breath while I move my hand upward toward the right side, upward toward the liver. And I palpate here, and I might feel the border of the liver. Perfect. Okay, now I'm going to palpate the spleen, which is on the left side, the left upper quadrant, and do the same thing. Ask you to take a Deep breath in. And to see if I can palpate the spleen, which I cannot, and that is a normal finding. It should not be palpable. So that is normal there. Now I'm going to perform a Romberg sign to assess for peritonitis, and that is taking my hand down into the abdomen in a 90-degree angle, and I'm watching for any rebound tenderness when I remove my hand. Let me know if you feel any tenderness. No. Any tenderness there? No. All right, and that is a negative Romberg sign. So perfect. Now I will assess passive range of motion of first I'm going to inspect the lower extremities and note that I don't see any redness or lesions or edema. Now I will assess passive range of motion of the lower extremities unilaterally. In the real world, it would be bilaterally, okay? We're going to start with the hip, and I'm going to flex your knee here, and in turn flex your hip for flexion and extension. Now we have abduction and adduction across the midline. Very good. Now I will assess passive range of motion of the knee, and that is flexion and extension. Next, I will test the strength of the knees. I ask you to flex your knees up for me, both knees. All right, and now I want you to put resistance against my hand. Push up toward me, perfect. And now pull back toward yourself. Okay, great. And strength of the knees is 5 out of 5 bilaterally. Next, I will test passive range of motion of the ankle unilaterally, starting with dorsiflexion, plantar flexion, and rotation. Perfect. Now I will test the strength of the ankles bilaterally, and I'm going to ask you to dorsiflex against my hands. Pull your toes toward you. Perfect. And now plantar flex against resistance. Excellent. And the strength of the ankles is 5 out of 5 bilaterally. Now I will palpate the dorsalis pedis pulses bilaterally, and they are 2+ and bounding. Okay. Now I will have you sit up for me, and we're going to go ahead and stand. All right, I'm going to assess the spine, and I'm assessing for normal curvatures and alignment. I'm also going to palpate the spine for any lesions or masses or tenderness. Okay, we're going to assess, turn this way, range of motion of the spine. Starting with flexion, I'm going to ask you to bend down and touch your toes. Okay, now stand up straight and lean backward for flexion, for extension, sorry. All right, that's good. Now we're going to do rotation to one side and the other side. Rotation, perfect. And then we'll do lateral flexion to one side this way and the other side lateral flexion that way. Perfect. Okay, and that's great active range of motion of the spine. Now I will assess your gait. I'm going to ask you to take a few steps that way. Turn around and come back toward me a few steps.